Well, welcome to 5 quick tips for patient satisfaction. First one, knock before entering the exam room door, and when you go in, use the patient's name. I've shadowed many doctors who, when we go in, the doctor says, "Hi, how are you doing? Hey, what's going on? Nice to see you again," but never name the patient. And yet, what does a patient judge your caring by? Well, whether or not you remember them from visit to visit. It's not hard. Always check before you go in. Check the paperwork, check the record, know who that patient is, and use their name. Tip number 1. Tip number 2, be seated as soon as possible. Now, I know some physicians have a protocol with their medical assistants by which they have the patient sitting on the exam table. That only makes sense if you're going to be examining a patient, let's say doing a pap smear, where she would be on the exam table because you've seen her before and so forth. But under normal circumstances, the patient should be in the chair. And then you come in, say hello, use their name, shake their head, and you sit down as well. Why? Because it gives you better eye contact with the patient, which implies that you're actually listening. Tip number 3. When the patient has described his or her problem to you, rather than automatically responding with, "Oh, really, and when did that start?" why not say something empathetic that says that you've been listening and you share their pain, so to speak. Patients will like you to the extent they believe you like them. How do you demonstrate that? By coming across as empathetic when they've got a problem. So if a patient says, "Oh my gosh, my shoulder is killing me. I can't reach the 3rd shelf to get this baking bowl that I love," rather than say, "We'll put the bowl lower," which is what some doctors might say, why not say, "Oh, that's got to be tough or frustrating." Respond empathetically. Tip number 4. Give the patient something to take away. In the olden days, before we had electronic records, most physicians would tear off the prescription pad, hand it to the patient, and the patient actually walked out with something tangible for all the effort they went to make the appointment, sit in the reception area, sit in the exam room, go through the exam, and leave. They had a reward, as it were, that prescription. Not any longer. These days, the prescription is one click and it's gone to the pharmacy. So what does the patient have when he or she leaves? Typically nothing. Why not jot something down, whether it's short, let's say a short phrase that will remind them of what the treatment plan is, or if you've talked about some over-the-counter medicine, why not write something down in that regard? Just tear it off, hand it to them. They'll feel as if they're getting something extra. And tip number 5, before the patient leaves, recap your advice. Recap for them what went on in the visit. It won't take longer than maybe 30 seconds, maybe 1 minute. But say to them, "So before you leave, let's review. First we talked about this, then we talked about that, then here's what you're going to do. 4th, you're going to do this. 5th, be sure when you go to the lab tomorrow morning or later in the week, fast ahead of time because we're going to get your cholesterol. And last but not least, make an appointment for a month from today." Have any questions, or have I answered all of your questions? That's the way to end a good visit. Let's quickly review the 5 tips. Let's recap. First, knock and use the patient's name. Second, be seated, give good eye contact. Third, be empathetic to the patient. Let them know you really care. 4, be sure they have something to walk away with. And 5th, recap the visit. Good luck.